Good morning. Welcome. I'm Stipp, and I am a senior specialist realtor. I'm your host today, and we're going to talk all about navigating the healthcare maze. I always forget to switch to the screen. That's me. There you go. That's me. So today our expert speaker is Lora Felger with First Medicare Direct, and Lora has been in the business for, I guess I don't have it up here. How long, Lora?
11 years.
11 years. Okay, so she's an expert in all things Medicare and navigating all of that. So we're going to get started this morning. You want to tell a little bit about yourself, Lora?
I'm kind of cracking up. She put that I'm a graduate of Iowa State University. That's my proudest moment right there, because none of you probably know what I'm talking about. The Iowa Hawkeyes and the Iowa State Cyclones played on Saturday, and we won with 6 minutes left on the clock. So I'm still flying high. We actually were, there's actually a large group of Iowa State alumni here in Raleigh. We're a very similar school to NC State in our focus and our colleges, and kind of the best schools in the ag focus and the engineers. But we had about 30 people watching the game at a bar in Apex, and I think those Tar Heels thought we were nuts. We really had a good time, and so yes, I am a Midwesterner. I started in the Medicare business actually in Nebraska for a company that is out of Champaign, Illinois, and it doesn't really mean anything other than the fact that that company out of Champaign, Illinois bought a company down here in North Carolina called First Carolina Care. It is a very small, I like to call it almost a boutique insurance company, because we don't have the most members. We prefer to stay kind of small because we do everything ourselves on site at Southern Pines. So when you call our customer service team, I say they have Southern accents because the phone is being answered in Southern Pines. And we are owned by the health system that is located in that area called First Health of the Carolinas. It's all first words: First Health, First Carolina Care, First Medicare Direct. That's all us. And we expanded about 3 years ago up into Wake County, as well as Lee and Johnston and Harnett after the buyout by the parent company that I had worked for. And I was ready to come south, and so I moved down here 3 years ago, and I do all of the sort of expansion work in our new counties. I do all the branding work to sort of bring our company to everyone's attention and let folks know that we do exist and that we do compete with the bigger companies. And I really have a heart for it. Medicare makes sense to me. Makes me a little twisted. And I like to try and bring it down to the most understandable bits and pieces and help folks really understand and maybe feel more empowered to know that they have what is right for them in their health coverage, because nothing is more important as we actively move into our retirement and our aging years than making sure our health care is in check and affordable. And so that is sort of my mission.
Wonderful.
All right.
So what is Medicare, Lora?
Well, Medicare was invented, let's say it was invented in 1965 by the Lyndon Johnson administration when it was signed into law, the Medicare and Medicaid Act of 1965, which gave us Medicare, which gave us the Medicaid programs that we have today. I joke, Medicare isn't even 65 yet. It's 3 years older than me, 59. So it has not even qualified to be on Medicare itself yet. But Medicare, in its basic state, as it was created in 65, was Medicare Part A, and Medicare Part B came shortly after that. Medicare Part A is your hospital coverage. So if you end up in the hospital and everything that you receive under that roof in the hospital, that comes out of your Medicare Part A. And Medicare Part B, as in boy, is your doctor coverage. Your doctor's office visits, but also your therapies and your lab work and all those kinds of things. Those two combined are called basic original Medicare. We qualify that in our lifetime by paying our Medicare taxes out of our payroll for the course of our career. You earn Medicare Part A, you pay into Medicare Part A and B throughout your life, and then you get Medicare Part A for free once you retire if you have paid in for 40 total quarters or 10 years. Now that's either you or your spouse. So the act of paying in for those 10 years qualifies for you to receive Medicare Part A for no premium. So nobody's paying anything per month for the Medicare Part A. And then the Part B is, and boy, has a premium. And it has slowly gone up year after year. When I started 11 years ago, it was $88 a month. Excuse me. It is now somewhere north of $170 a month. But you do have to pay that premium in order to have those two together. Medicare, original Medicare is an 80-20 plan. So you're familiar with that maybe from when you were working and you had to pick an 80-20 or a 90-10 or a 70-30. What that means is Medicare itself will pay 80% of your expenses in various ways through co-pays and co-insurance, but when it all comes out in the wash, it's basically an 80% coverage plan. The problem is that there's no maximum out of pocket for an A&P plan. So if your bill is $1 million, you're still on the hook for that 20%. So you're still going to get a bill for $200,000 because Medicare only pays 80% of that. So where the confusion and the having to shop and the things like that in the mass market come to be is when people are trying to fill in or cover that other 20%. Okay? And you do that two different ways, either through a Medicare Advantage plan or through Medicare Supplement. We'll dive into that a little bit, I think, in the next slides. So in order to get yourself covered at 100% rate, you have to add something, a supplemental plan of some kind to fill in what original Medicare doesn't cover. Well then, in the 90s, the government came out with your drug plan, and it's Medicare Part D as in drugs. But the government did not want to take over running a drug system. And so that is all done by private insurance as well, which gives you another shopping opportunity where you have to select how you want to receive your drug plan. You are more than welcome to not take a drug plan if you choose not to. However, you will be assessed a penalty based on deadlines drawn in the sand. After X amount of days, they will start assessing a penalty to you for every day that you go without that drug plan. Should you ever need it later on in life, they're going to come back and collect that penalty for the rest of your life. So it's kind of like car insurance. You buy it because you don't plan to go run into a tree tomorrow. They need you to be paying into the drug plan whether you need it or not, so that it is there for you when you need it.
Okay. So what do people need to add to original Medicare?
So we just talked about that, right? The Medicare Supplement or the Medicare Advantage plan plus the drug plan.
Okay. And what happens if you don't have a Medicare Supplement?
Well, you're on the hook for that 20%, I think, is the most important part of that piece. But also, a lot of the supplemental plans on the market anymore through Medicare Advantage, and maybe a little bit through traditional Medicare supplements as well, offer a lot of extra, I'm going to call them benefits, but enhancements that you would normally have to buy yourself. For instance, dental coverage. Most all plans nowadays have some dental coverage included with them at no extra cost. They also provide some vision for hardware and lenses. A lot of them have special gym memberships that are added for free. So there are certain things that come along with buying those supplemental policies that sort of enhance and help keep you healthy, to be honest. They say your teeth are just as important to your cardiovascular health as anything else. So there are good things that are added into these plans.
So that makes me, I'm just curious, do any of these plans cover hearing aids?
Yes, but in various ways. For instance, my company contracts with an organization called True Hearing, and the True Hearing provides the hearing aids. They'll come out and do the audiology assessment, and then they will offer the hearing aids at reduced prices or co-pays. But usually you're going to pay, upwards of $1,000 for a hearing aid, which it tends to be less. It gives you a large discount, but I don't know of really any plans on the market that are paying for hearing aids 100%.
Okay. What is new in 2025?
Anybody been following what's coming up in 2025? Are you going to hear this from me for the first time? All right, we have a significant, everybody listen up, this is a significant change to Medicare in 2025, and it involves your drugs. So if anybody takes drugs, and even if you don't and you have a drug plan, this is going to affect you. When the Medicare drug plans came through Congress and were enacted into business, we had something called the donut hole. Everybody heard of that, or the coverage gap? Anybody in the room ever fall into the coverage gap? All right, this is significant for you. The coverage gap is going away in 2025. Goodbye. Last year, I think it was somewhere north of $5,000 in out-of-pocket expense paid by you and your plan towards your drug needs, put you into the coverage gap where you picked up 25% of the cost of your drugs for the rest of the year, unless you came out on the far side and ended up with catastrophic coverage. That has been completely eliminated in 2025. What they have added, and you're going to all be happy, is a $2,000 maximum out of pocket. What that means is once you have paid out of your pocket $2,000 towards your drug needs, you will be done for the rest of the year. So you'll never pay more than $2,000 for your drugs unless they are off formulary. We can talk about that a little bit later, but the $2,000 maximum out of pocket is a significant change. In addition to that, they have put out what's called the M3P, and I don't know what it all stands for, but basically M3P is your ability to take that $2,000, especially if you hit that in January. There are many people on expensive drugs that may hit that $2,000 in that first trip to the pharmacy. You're going to be able to finance that now over the 12 years. Now I say finance it, there's no interest on it. You're going to be able to take your $2,000 divided by 12 and pay that monthly over the course of 12 months.
It's like whenever you have your electric bill that they divide the average.
Kind of like that, yeah. Now, somebody has to administer all of that, and somebody has to figure out how to stay in business and go down to the $2,000. And that all came back on insurance companies. So the insurance companies have all had to try to figure out how to make that work. I have to be honest with you. We don't know how that M3P program is going to work. And we have gotten very little guidance from the federal government on how to administer it, how to hold people accountable throughout the year, because really you could stop paying anytime you want, and there's not a lot. We can't kick you off the membership. We can cancel your prescriptions, but there's going to be the pain of figuring out how to make that work. Starting in January. The 2,000 is pretty automatic. It's going to be done through computers, and that'll happen fairly easily. But when you go in January to pick up your drugs, your pharmacist is the first point of contact who's going to let you know about the M3P program, as well as whether or not you're coming up to hitting that maximum out of pocket. It is very exciting for people on expensive drugs. There is going to be a domino effect for everybody else. Some changes made in the way companies are figuring out how to spread that out throughout their drug plans. So I encourage you all, when you get the information, which should be coming out imminently from your drug company, to make sure you get your list of drugs, sit down with their formulary, and make sure you know what the changes are going to be for you in 2025. What I've seen, and I can't tell you that because we're not allowed to go into specifics until after October 1st, but you're probably going to see deductibles added where there weren't any, and maybe a change in how you pay for those higher tier drugs. If you're taking generics, ones and twos, things that have been around for a long time, it's not going to affect you too much, but if you do take one or two tier 3 or above drugs, things can change for you. So be on top of it, and if you do anything this year, make sure you just do that this year. Check your drugs and know where you stand. And if you can't accommodate that change, it would be time to shop for a new plan.
Is it okay to ask questions now during your presentation?
What do you think?
Sure. Okay. I don't know what a formulary?
So formulary is every drug that a company is willing to pay to cover. And then they put it into usually 1 to 5 or 6 different tiers. And so, for instance, something very generic like an antibiotic or a cholesterol drug like simvastatin, those tend to be the lowest tiers, tier 1s. Those are your generics that you probably still get at Walmart for $2, but you might get them for free on your drug plan. And then, honestly, the newer the drug, the higher the tier. I always joke, if you see a commercial for it on television, you can't afford it. Those are the newer name brand drugs. They haven't gone generic yet, and they can go up into tiers 3, 4, and 5. So 1 and 2 tend to be generics, older generics, newer generics, and then tiers 3, 4, and 5.
And where do we find that list?
So on your drug plan, you will either get one in the mail, a formulary in the mail, or you'll have to go onto their website and look for it. You will not be able to see the formulary for 2025 until after October 1st. That's when we're allowed to release that information. Yes, ma'am?
Can't you still, I'm on an Advantage plan, but can't you still get your doctor to write a letter requesting that you get a certain drug if it's not on the formulary?
Yes, you can ask for a formulary exception, that's what it's called, and you can request that if it's not on, and then drug company, the insurance companies will handle that on an individual basis. But getting your doctor involved is the key to that, absolutely.
So it's not guaranteed? If your doctor writes a letter?
It's not guaranteed.
Okay.
They may say, we still want you to try something else. The new buzzword in pharmaceuticals now is bioidenticals, which is basically generics, but it's bioidenticals to some of those injectables that we have on the market now, like Humira, which is a drug that's used for many things. And a lot of companies are going to be very interested in the bioidenticals to the Humira because the molecules are the same. They're just, it's like the generics of the normal days. Yes, sir.
If you have a health savings account or a health resource account, can you apply that $2,000 against it?
You can use your health savings account to pay your co-pays and pay for your drugs until the $2,000, yes. For your Part B, yes. Or your Medicare Advantage plan.
Okay.
Yeah, I have one of those too.
Okay. Next up. Oops, let's see. I put a brand new battery in this morning.
Well, I will say, as a result of the big changes coming in our drug plans, you may see some of your other, if you're on an Advantage plan, you may see your dental benefit go down a little bit. You may see a few dollar signs changes with co-pays. Look for those and just be aware of any changes because it just, like I said, there's a domino effect to something that major. And you'll see that reflected in various places.
Okay. So what doesn't Medicare pay for?
Well, I think the biggest one, and this is in definite support of the panel that Karena, we have another real estate friend named Frida, that you've been doing and talking about through your series is it does not pay for home health care. And I say it doesn't pay for home health care is it doesn't pay for those activities of daily living home health care. It will pay, Medicare will pay if you need a skilled nurse, an RN, or a respiratory therapist or a physical therapist or something like that coming into your home and delivered, what we might call prescribed medical care, but it's not going to help you, lift you out of bed in the morning or provide the assistance of helping you take a shower or that lower level of nurse's aid level of care that people bring into their home. At the rate of, $35 an hour now in the market. Medicare doesn't pay for that. They only pay for medically necessary care. Okay. Other than that, of course, every plan has their magic Bible of what they do pay for and what they don't. They don't pay for cosmetic surgery. You can't get your eyes done. Unless, of course, you have a condition where the eyelid is starting to fall over and interfere with your sight, then they'll pay for that. But you can't just go get a facelift, unfortunately.
Yeah. What's the difference between Medicare and Medicaid?
Oh, okay, that's a good question. So they both were signed into law in 1965. Medicare is a federal program. only for people who are 65 and older, unless you are recognized as disabled by the Social Security Administration. If you collect disability under the age of 65 for 2 straight years, you go on Medicare. So I had a client, well, she's probably older now, but I had a client that came on Medicare when she was 35 years old because she had been disabled for 2 years. Medicare is blind. You don't have to have a certain income. You don't have to have worked for 30 years or 40 years, just the 10 years to qualify for the Part A, or your spouse has done that. So everybody that is over the age of 65 qualifies for Medicare if you're an American citizen or have a green card, and I can't remember the number of years your green card has to be in effect, but as long as you are a legal American resident, you qualify for Medicare. Medicaid is a federal program, but it is administered by the state, so I should go back. Medicare's federal. What that means is what happens in Arizona or Ohio or North Carolina, the Medicare rules are going to be the same. Okay? There is no change in your Part B premium because you move from one state to another. There's no change in what Medicare will pay for and won't pay for because you move from one state to another. It is universal in all 50 states. Medicaid is a federal program by mandate, but it is administered by the states. So Medicaid rules will be different from state to state, from South Carolina to North Carolina, from Illinois to California. You're going to have different Medicaid rules based on the state that is administering them. That can include basic income levels, as well as who does or does not qualify. So if you get to the point where you are getting ready to be eligible for Medicaid in the state of North Carolina, and you're on Medicare, you can do both. It's just something to think about if you're going to move to another state, maybe to be closer to a family member as you age, that the Medicaid that you know in North Carolina may not be the same as it is in that other state.
Okay. And Medicaid is what can lock in, for instance, for someone who needs to go into skilled nursing.
So Medicaid is a giant monster that is cradle to grave. A child can be on Medicaid, an elder person can be on Medicaid, and there are various compartments and departments of Medicaid funding that flows to those various areas. So when you're on Medicaid, maybe as a young single mother, and the Medicaid you're on, once you turn 65, that's 2 different pots of money, different sets of rules, different income levels, so things change throughout the life. But one of the things that people talk about in the end of life is if you're institutionalized, having to live in a nursing home and having to transition over to having Medicaid pay for that because you have extinguished all of your resources. Again, that's another department within the Medicaid monster that I avoid with the plague. And there are income levels, there are asset levels, there are certain assets the spouse can keep, even if the other person needs to be. And I say to you, hire a lawyer when you get to that point, because that's very complicated. And we know a guy.
Who is it?
Rick Mesmer.
Rick Mesmer is good.
He works for a firm called Houston Law. They're very good.
We've also had Hayden Baugh, who's spoken here at our seminars before.
Yeah.
So Rick and Hayden both have. And Rick also does estates and so forth.
So this is a good one. What is long-term care? So long-term care is that institutional need for assistance, but it can start to the smallest degree with having someone come into your home and help you out, help you get dressed in the morning, help you take your shower, make sure you got your pills in the right days of the week, in the right order, things like that. That's technically long-term care or short-term care, depending on, maybe you don't need it for forever, but long-term care is a giant animal that starts there and goes all the way up to needing 24/7 service with a full paid nurse. You know, maybe you're on a ventilator or something. So there are varying degrees of long-term care that people need to understand. And then there are various levels of long-term care of how you live. You can live 100% independent with that help from maybe a little bit of maybe 4 hours a day. You can move into an independent living facility where everybody is in the same, age of life. Maybe you're still driving, but living under that one roof, you just don't need to be taking care of the yard anymore. And some of those independent living facilities will offer you food. You can buy a food plan, or you don't want the food plan, you don't need it, you don't have to have it. Then you can go up a level to assisted living where you get a food plan, but you also get, 24/7 service where you can pull up help, if you fall in a restroom or something. That's assisted living, or they check on you daily to make sure you're up and around and taken care of. And then you have memory care, which is for people who have memory issues and need to be maybe kept in a little bit higher level where maybe the doors are locked, so that if you're someone who, likes to go on great adventures, they don't want you doing that. So there's memory care, and then of course there's full-on skilled nursing care where you have a hospital bed and 24/7, eyes on you. So long-term care is a very large animal, very large descriptor, and there are people in our industry that we know, again, that can help you with that and discuss things like long-term care insurance, etc. Yes?
Is memory care or someone with Alzheimer's or other types of dementia, is that considered a disability?
Getting to the point of is Medicare going to pay for their care, their living? I don't know I would ask a lawyer for that question, but I will tell you this: the living needs of someone with Alzheimer's is not going to be covered by Medicare. The medical needs of someone living with Alzheimer's, either the prescription of the drugs that they take, maybe some therapy, there's music therapy and physical therapy and different things for people with Alzheimer's, that will be paid by Medicare. But the living needs would not be taken care of by Medicare.
In other words, if they go into a memory care community, that's not paid for by Medicare?
No.
It's private pay?
Maybe some of the services that come into them would be.
Yes.
A lot of these living facilities now even have home health on site that will come in even on 15-minute increments, some of them. So can you apply for disability if you're diagnosed with Alzheimer's disease? I think you probably could if you're under 65 and still of working age.
But not after 65.
But after 65, probably not, because you're considered retirement age. That's a good question, because we're seeing more and more early diagnosis of Alzheimer's. Frontotemporal comes on in their 40s. That's what Bruce Willis has. To me, that would be a diagnosed disability, but I would talk to a lawyer about that.
So we're up to questions and answers. I'm
going to make it my North Raleigh meeting. This is your opportunity to stump the Medicare lady. I'm here to answer your questions. I cannot be specific. They'll kick me out. Jenny will come in here and chew me out. But I can certainly answer any questions that are working on you. Yes, Ann?
I might be kicked out asking this one. Could you compare and contrast what you do versus what SHIPS does?
Okay, so SHIP is a state-funded service that is usually provided through senior living or senior centers like this one. They are non-biased, trained by the state on the basics of Medicare, and their job is to take you through and analyze what you have and help you make an informed decision on what is the best kind of coverage for your needs.
And it's free.
And it's free. And they are wonderful. I will tell you that they're very well trained. North Carolina does a really good job of getting their people ready to go. They are all volunteers. Some of them may have worked in the insurance industry and have since retired and are doing this as part of their volunteering and give back. But some of them are also staff members. They have other jobs as assigned at a senior center, but SHIP is part of what's in their job description. SHIP stands for Senior Health Insurance, I don't know what the P stands for. Program? Yeah, we'll go with that. Yeah, that makes sense. But they're wonderful, and I highly recommend them. What they don't always know or won't tell you is, where there might be some rubs, where, there's, some trouble with customer service, or there's very little. You really need to be careful about making sure they're checking your doctors and making sure that their doctors are in network, and et cetera. I think they do a great job. You need to make an appointment with them if you want to talk to them this fall and have them go through that, helping you go through your stuff, because they're going to get very busy this fall. My job, I work for one company. I work for First Carolina Care. But First Carolina Care pays me to be sort of the face and the brand of the company. I am a licensed insurance agent, but that's not my number one priority. My number one priority is helping people understand what they have and feel comfortable with what they have and know that they're getting what they need. And if they don't, they're more than welcome to give us a try. But that's not my focus. My focus is education and making sure that stress over your Medicare coverage is not contributing to poor health outcomes for you all. So, her first, and then I'll come back. Yes.
I dealt with SHIP many years ago around, my mother was still alive, and I went to SHIP with her because she was on Medicare Advantage plan, and I didn't like the plan. I had never seen people that, I knew more than they did. They knew absolutely nothing. I mean, I'd ask them a question, and I talked to several.
Was it here? Was it here?
At this facility?
Yeah.
No.
Okay.
No, I met with them and I talked to them on the phone. This was in the early, like 2020, 2004, 2005, something like that. And I met with them, I took all my mother's papers, and they were like, I don't know.
I'll give you my card later, we'll talk. Sir, what was your question?
Is hospice care in your home covered under Medicare?
Medicare covers hospice under Medicare Part B, and it is strictly out of Medicare Part B, so Advantage plans don't get involved with, you have to go to this one or that one.
It's not covered
But
under
providing
Medicare.
hospice care in your home is a rub. I don't know a lot about it. They may say and honestly, there isn't a lot of beds in a facility in this area. It's even worse in Fayetteville. I think they only have 10 whole hospice beds for the whole town. So in order to get hospice care, it almost has to be in your home. So you have to work with the hospice company to do that. Can you speak a little bit from experience maybe, where maybe it wasn't paid for, or you had to pay for some of it?
A relative is under hospice care, and I'm curious if it's covered under A.
It is covered under Medicare Part A, but how they deliver that service is definitely a question you need to talk to hospice. There are many here in the area. Transitions is the big one, but
It's my understanding it's 100% paid for.
but whether they deliver the service directly to your home or they want you to be in one of their, even a floor at the hospital, sometimes there's hospice
Well,
floors.
and this was strictly just my own experience with my mother a couple of years ago, and it was in Missouri, but it's Medicare, it's federal, so it wouldn't matter. But it was in her home, and it was 100% paid for, and they brought, it was everything. It was equipment, it was
The bed.
briefs, it was wipes, every single thing they brought in the house was all under that umbrella. But she had to be qualified for hospice, so the doctor had to write the
Right,
order.
they have to have that
Yeah, so
diagnosis.
you do have to have that diagnosis. And hospice doesn't have to mean necessarily end of life. You can actually go into hospice, back out, and we've had a hospice expert speak before,
Yeah, I've known
yeah.
people in hospice for 18 months.
Yeah,
It's a diagnosis code that triggers Medicare then to pay. But like I said, there's very little facilities for hospice in a setting, and so I think a lot of it is being done.
and it's also my understanding that the doctor told us this when my mom went on hospice. So once you go on hospice, it actually gives you a fast track to the doctor and to medications. So one of the things we had, instead of having to go pick up my mother's medication, they would actually, hospice would go pick it up at the pharmacy because we were the ones who were the caregivers and couldn't leave the house. So they would pick it up and bring it to us because I was worried whenever her prescription came up and I thought, oh gosh, who am I going to get to watch mom when I go? And I didn't have to worry about it. Hospice brought it to us.
Once hospice takes over, the business that I'm in kind of steps out, and hospice pretty much runs it all.
Yeah.
So I don't know a lot about it. All right, so you, then you.
Unlike the experience you had, we've had wonderful experience with SHIP over the years. And we've gone to different people I've also done it myself online because it gives you all the information that those people are
Right.
working with.
I was gonna circle back to that with you. I think you get, sometimes there's good apples and sometimes there's bad apples. I do think that this particular senior center is high quality and they do have good counselors, but some of those rural areas, they're harder to come by. So remember, they're volunteers. But if you don't like the one you got, I'd say keep looking.
That's right.
Yes, ma'am.
So you have to be, in order to qualify for disability, for hospice, how do you qualify for that?
Basically, you need to be terminal. You need to be diagnosed as terminal.
And your doctor will have that conversation, and it has to be agreed upon, because my mom actually refused at first, when the doctor brought it up, probably 4 months before she agreed. But we got to the point where she needed a hospital bed, and so I, had the talk with her and said, "It's time, Mom." And we actually had the home health nurse came in because she'd been in the hospital, rehab, and then back home. And it felt like an intervention, where we, in that case, where we all kind of circled the wagons and said, "It's time." And, she acquiesced pretty quickly at that point, but it's different, I think, with all different types of people, but for her, it felt like giving up.
You hear the word hospice, you think end of days, and it is. Yes, sir.
Using your crystal ball, do you expect premiums to increase in the Medicare Advantage programs based on the financial difficulties that companies like Humana and United Healthcare are having with their programs and
Yes.
people to be dropping?
Yes. If you're on a $0 plan, most companies are working diligently to keep that zero at zero. But if you're paying a little bit of a premium, I think you can expect an increase. If you're on a $0 plan, you're probably going to see a decrease in some of the ancillary benefits like dental and maybe a few dollar increase on copays. But yes.
Yeah.
Yeah. Bob, I thought you were next. Did you have a question?
I have been wondering, I see all these ads on TV about people advertising their Medicare Advantage plans with cost you less, we give you free this and free that and free something else. And I never believe them.
Okay, so what you're seeing on TV, there's a new one. I just saw it the other day. All I have is an antenna, so I watch Cozy TV and Me TV. That's all I ever watch. But there's a new one that I've never heard of before that's started. Preferred or Prestige, I don't know what it was. What those are giant clearinghouse agencies, really, but they're internet or online. They've gone out and they licensed a whole bunch of people with Medicare licenses. They put them in a call center, and they are casting a wide net to get people to call them, and they'll say things like, get dental, get hearing aids, get everything under the sun. But what they're doing is making a blanket statement about individual plans and what individual plans are offering. And once they get you on the phone, they're going to ask you those questions, and then they're going to narrow it down to the ones that are available to you in your zip code. But they are just giant call centers.
They're a brokerage.
They're a brokerage, but they're a brokerage that is nothing but a call center that puts out that commercial and then you're calling in. So they are answering calls for people from California, from all over the country. And then they're just typing into their computers, and then they're looking at the list, and they're probably using the same CMS search tool that you do if you went to cms.gov or medicare.gov and entered your zip code yourself. You're not going to get a lot of individual care and coverage that way, but they serve a purpose, if that's the only way that you can maybe get some help. But what they're promising in the ad is everything, and then they're going to narrow you down. For instance, buying your groceries or giving you those giant payback cards, those are Medicare, Medicaid combo programs. So if you are eligible for Medicaid, you're not eligible to get those grocery cards, okay? Because that's Medicaid kicking in with whatever Medicaid kicks in with. But they're going to give you the world in the commercial, and then they're going to figure out where you fit once they get you on the phone.
they're also doing telemarketing, because even though I have blocked calls.
Right, right. Now, technically, that is illegal. And so when somebody calls you, if you feel a little frisky, you can ask them for their license number, and they'll probably hang up and leave you alone. But you may have clicked something on Facebook, thinking, oh, I want to know more about that. And the click is an implied consent. And so be careful what you click on. We're advertising, my company advertises on Facebook. My company sends you those flyers in your mailbox. But be careful what you go deeper into off of the internet, because that may give them the implied consent then to start blowing up your phone. But technically, it's illegal for us to contact you unless you give us consent. And I get that consent in writing. It's called a scope of appointment. We get those in writing. So you have to wade through a whole lot of noise, and it's gonna get so noisy this fall. I'm sorry, it is. We got an election, we got Medicare, major changes in Medicare with a lot of people that are gonna be looking to make changes, and it's just buck up, Judy, it's time. It's gonna be a loud time of year for all of us.
Changes in Social Security too.
Yeah, and then the election, and who knows what's gonna happen after that. So, it's gonna be, we've been prepping for this since April. My company says, this is gonna be a hot year. And when a company knows that ahead of time, it's gonna be a hot year. Do you have a question, or are you working your
I'm
fingers?
curious, about the difference, like, if you sign up for traditional Part B with Medicare, or you go to the Advantage plan, once you go to Advantage, you can't go back.
Okay, so if you sign up for a Medicare Advantage plan and you decide you want to go back to a supplement later on in life, you have a 12-month trial on an Advantage plan. So you are able to go back without underwriting. If after that 12-month trial doesn't work, you can go back. If you stay on an Advantage plan for 5 years and you decide to go back, you will probably be subject to underwriting from the supplement company. Now, several supplemental companies offer what's called a guaranteed issue, which means they won't do that to you, but you're going to pay more in premium for that luxury. So, it's up to you.
And everything's covered, you don't ever pay a bill.
Well, you pay the premium.
Well, yeah.
Yeah.
You pay once a month, but you never have a bill from a hospital.
Exactly. And this is a good, probably one of the slides we should have had. There's two different philosophies on that. When you go to Medicare supplement route and then buy a drug plan, you're going to pay premiums, okay? Because you're going to prepay for care you may or may not use. So you're paying every month your premiums on your drug plan and your supplement. Now, those supplements are going to go up as you age. They're going to increase your premiums every time you age. Every year you get older, you're going to see them go up. They're also going to go up with the cost of business, of doing business. So you get into your 70s, my dad's 82, he's on a glorious Plan F supplement. It's beautiful, it pays for everything, but he pays close to $500 a month in premium for that in his drug plan. Okay, is he using $6,000 a year with medical care? I'm here to tell you he's not. So he's prepaying for care he either uses or doesn't use, but that money goes. The other side of the aisle, it's everybody's own personal philosophy, is the Medicare Advantage route where you pay almost no premium. And honestly, in Wake County, there are so many $0 Medicare Advantage plans out there that I would not be paying a premium. I think you can find a high quality plan. You're foregoing the idea of paying every month in exchange for paying as you use. And so you go to the doctor, you pay a copay, you have a test run, you pay a copay, and then you have a maximum out of pocket. So the maximum out of pocket in Wake County is somewhere south of $3,000 a year. So when I look at it, and then you need to do the math, and it depends on where you are in your age, but if you're gonna pay $6,000 and never see it again, or $3,000 maximum if everything goes wrong, philosophically, you have to decide how you want to do that. Now, there is value in not getting a bill, especially when you get older and or you're the child who has to keep track, okay, as your parents get older. There's value to that, of knowing everything's taken care of. It just depends on where you are, who you are, what your experiences have been in life, and how comfortable you are with handling your finances. Yes, ma'am?
when you're mentioning those premiums, that's on top of what you have to pay into Medicare B.
Right, and you're still paying the Medicare Part B
So
premium,
whatever.
everybody has to pay that, yeah.
So your dad's actually paying 7,000 something a year.
Yeah, probably, I mean, I would tell you, I could punch his
Somewhere between
financial right now.
150 and 500 a month just for the Medicare.
Right, and if you're a couple, that's times two.
Yeah, it's been ridiculous.
Yeah, Bob.
Well, if I can just make a comment, I have a supplement plan, Blue Cross Blue Shield,
Mhm.
okay? And I am writing other people's payments. I'm only 76 now, and I've been getting much more benefits than I pay.
Right, I mean, some people use that benefit, you know, it depends on your health. My father doesn't even take a drug. So, you know, and he goes to a chiropractor if he's in trouble. So, I see it as money he can afford to lose. It's not like he's suffering. But, you know, as baby boomers age in, some of them still have mortgages when they're retiring. And some of them are very, very interested in going the stay healthy, keep moving route, and would rather invest their money maybe in you know, high-end running shoes or something, and not pay that premium on the front end. So, again, two different philosophies, and fortunately, everybody has that choice, because everybody's in a different place in their lives. Yes, sir?
But that's true for everything. You buy an electronic item, do I get insurance or not?
Yeah.
Car insurance, homeowner's insurance, life insurance, do I get it or don't I get it?
Don't I get it?
And am I gonna pay it or no, I'm not gonna pay it? Will it be worth it to me the next year? Who knows?
Who knows?
Who knows?
And that's,
If we
you know,
have a
welcome to
crystal ball
consumerism.
that told us when we're gonna die,
Yeah.
or have run into health
Yeah.
issues, it solves the problem.
You told me to look into my crystal ball, but believe me, it's very murky. Okay, so I have to be in North Raleigh for a meeting in a minute, so I'm gonna take two more questions, and then I'm gonna run.
Well, what if your Medicare Advantage plan drops you for the hospitals, like a lot of the hospitals, like
Right.
United Healthcare is in another battle with Duke right now. Last year it was UNC, the year before that it was with another.
Those battles are more and more, happening more and more often as the cost of everything, the pinch, because they have to come to an agreement on what they're willing to pay for every single conceivable medical need. And so those contracts get heated, get hot. Humana still doesn't have a contract with Wakeman. Still, it's been over 2 years now, I think. When that happens, you either have to change your doctors, if you want to stay where you are, or you have to change your plan. And that happens in the fall, when you can change your plan. Now, if the plan leaves, we're gonna see a lot more of that happening too, where plans are saying, "Ooh, we gotta get out of this market, we can't afford to stay in it." When they pull out, they give you what they call a special enrollment period where you get to pick a new plan. But it's happening.
Well, I'm finding a lot of doctors who are not accepting
Yeah.
Advantage plans now too.
So far so good with our contracts are good. I mean, they're gonna have to figure out how to do business together because they're in it together. They're symbiotic. In my situation, it's so weird because we're owned by a health system. A hospital owns us. And so our contracts are a little bit different, at least in like down in Moore County, we're all in the same boat, so our contracts go through a little bit easier. But those negotiations with the big three here in Raleigh are getting heated, and every one of the companies are feeling the pinch for sure. You just have to, pay attention and be on top of it. Okay, one more question, and then I gotta roll. Oh man, I put too much pressure on you. Okay.
I have one. This does not have to do with us, but a neighbor, and this bothers me to no end. She calls EMS for every small thing, and I'm not exaggerating, a stomach ache because she ate too many French fries, a hangnail that wouldn't stop bleeding, and so EMS comes. My irritation with that is this pot of money that Medicare has is being drained. Her situation and her calling cannot be unique. Why?
No, it's not.
And I know you don't have an answer to this, but I just need to get it out of me. Why isn't there someone who says, whoa, no more?
I certainly hope that they're giving her a little bit of a social work look once they get her in the,
No,
in
and
the
that is
ER.
not happening.
Yeah, that's unfortunate. I know some of the things that insurance companies are due to try, the only thing we can do is affect you financially. So we raised our copay for the ambulance ride and lowered our copay for the urgent care.
She
You know, so
said she
urgent care is gonna be as low as
doesn't
zero, but if you go by the ambulance, you're gonna pay. And I don't know, she may have a really good supplement that just keeps paying.
It does.
Yeah, it's frustrating. In Portsmouth County, you can pay, what is it, $60 a year and have unlimited EMS response. But somewhere, somehow, EMS, the hospital, you know, she probably sees a different nurse and doctor every time she goes to the ER. Somewhere, somehow, she needs to get on somebody's social services radar. And if not, her children need to be notified. Yeah,
Where?
it's a sad world. It's a sad world.
3 or 4 years.
Yeah, unfortunately, that's how it goes. But we try to start you out financially and say, every time you go by the ambulance, we're gonna charge you more. Please go to the urgent care. And that's why there's so many of those now, because they're filling that because, and you know, and CMS puts the pressure on hospitals to lower those kinds of admissions, those kinds of things. But emergency response has to respond to that. There's no other choice, but she's become a frequent flyer with them, and I'm sure they know all about her. All right, I have to shut off. I am more than happy. I am not going to pressure you to sell you my insurance. But if you have more questions, you want to talk through an idea, like I said, my role is more making sure you're comfortable with what you know and what you have, and you don't want to make an appointment at SHIP. I'm going to leave my business cards here. Email me, text me, I will answer you back. Thank you all for your time. I did not count. How many did we get today?
Oh, I don't know.
2, 4, 6, 8, 10, 12, 15. Nice. All right. Thank you all very much.
Thank you, Laura. Thank you. If you have friends, relatives, neighbors, anyone who needs to hear what you just heard today or any of our other seminars, please send them to my website, Southern Accent Homes. You can click on that QR code with your phone. It goes right to it. At the top, it'll say The Real Truth About, which is the kind of main heading for our seminars. When you click on that, it takes you right to the list of all the seminars, and you can watch replays there. Thank you, Laura. And then the next seminar coming up will be Technology for Seniors. We're going to have 3 speakers next month. We'll have Philip Carter, who is a technology guru. We will have a doctor of audiology who will talk about all of the new technology available with hearing aids. And then ClearCap will speak for about 5 minutes and tell you about a free service that's available to you as well. So that's next month. It's October 16th. I think that's actually a week later than usual. I'm in a conference for my senior certification in Oklahoma next month early.
What was the third one?
ClearCap, Clear Captions. Clear Captions is the name. It's a free service that's available to you for captioning for your phone. Yeah.
Oh.
So she's a fast, she can tell you about her service very quickly. So I threw her in because there's people who don't know about that, and it's free. And if that's something you need or you know someone who does, it's good to know about. So that's next month. One of the things that we're working on, my neighbor Bob and I back here, Bob's my cameraman, and we are starting to do video tours of different senior communities. So if you ever kind of wonder about those, I have someone working on cropping and captioning our first tour that we just completed not long ago. But we'll be getting those tours up on my website as well, and you can see what does it look like to really live in one of these senior communities. And you can see firsthand all throughout the community, and we talk to some of the different residents there, the sales directors, all of that. So you get a real world view of those. Yeah.
On those, Karena, are you all able to include what the prices are? Because sometimes online, it's very evasive.
So I didn't get into the pricing when we did the first tour. Honestly, truly, that changes every year. So part of the reason I didn't was so that the tours would endure, from one year to the next. And they're probably going to start changing their prices in the next couple of months anyway. So usually in January, they'll do a 3 to 5% raise. And that's pretty standard in the industry across all of them. So part of the reason they're kind of vague is because it differs. So if you go in as an individual, it's different than if you go in as a couple. There's usually about an extra $1,000 a month if you're looking at independent living, okay? And then there's different meal plans, so there's a lot of differences. It's different based upon whether you want a studio or a 2-bedroom. And that's, but if you want a general rule of thumb, probably the lowest price in the triangle, there's one on Spring Forest that used to be called Trio, it's now called Willow. And that will start for a studio, which is about 600 square feet, and this includes 2 meals a day for one person, just under the $3,000 mark. That's as low as it can get. And you go up from there. So probably the average would be closer to around $5,000 a month for independent. Yeah, that's independent. Now, if you're thinking, well, you know, somebody or you are maybe on the cusp of needing some help, okay? A lot of times you can go in independent and you can stay there for a good long time if they have services, and most of them do, on campus. And one of the things Lora mentioned was a 15-minute, some of them will call it a drive-by. So if you are living in 123 Main Street, your house, if you need help with activities of daily living, you'll pay a minimum, as a rule of thumb, from any home healthcare provider or someone who's even if they're not licensed nurses and you just need somebody to come help get dressed or shower, they're going to charge a minimum of 4 hours for that visit, even if you don't need 4 hours. If you're in independent living, they'll charge as little as 15 minutes. So you actually save money. There's actually a couple that lives in Atria. We interviewed the wife. The husband had been a dentist. He had a spinal stroke and needs a Hoyer lift. And just to get in and out of bed every day, and then he's fine, he's in his wheelchair. So they have someone come 15 minutes in the morning, 15 minutes at night. Atria Oak Ridge actually has a special certification that allows them to be independent but lean heavily into the assisted living space because they have staff 24 hours a day. It's a whole thing. So they're able to live together rather than him in assisted and her in independent, even with a Hoyer lift. And they're just using help essentially for a total of 30 minutes a day. So that's actually a savings for them, and it's something she couldn't handle at home. So had they stayed in their home, they would have had to have someone come 4 hours in the morning, 4 hours at night. So now you're paying for 8 hours because it needed help to get in and out of bed. So sometimes it's well worth looking at if you get to that, if you get to that point where you need some help. Or even if you don't, you just are interested in not all the responsibilities, etc.
And you help in those, in finding?
I'm not a placement person, so for instance, a place for mom. Anything like the placement services, just know that they operate by getting paid a kickback essentially when they place you. So that's not my business model, right? I'm there to help you sell your house. And so if, by the way, you need to move into or want to look at living in independent living assisted, then I'll go tour with you. And I'm familiar with them and I know the lingo and know what questions to ask. So I do that, it's part of what I offer. It's not my primary business model, no. But maybe that's better because, I'm not beholden to just 3 different places because those are the ones who pay me, right? So you don't get to see the full menu if you're going with a placement service. Nothing against them, they're great people.
Yeah, when I first moved back, we called the place for Mom when she was ready to go into facility. I kept calling them because they sent us to the worst places, and we ended up at Sunrise. Years, she was only there maybe two years, I guess, or something. Had nothing but problems at Sunrise. I mean, stealing her drugs, stealing her Depends. I found her. If I hadn't showed up when she did because of the norovirus, they wouldn't let me in. Found her in bed with her face in the pillow. She would have died. She was suffocated. Vomit everywhere. They didn't clean it up. Came back from the hospital one night. They were in her room stealing her Depends. We finally had to get an attorney when we moved out because they were charging her double charging her on her money.
And some of those things, I will say, sometimes I hear good, bad, and different about different places, and that will change. And some of that changes with management or with owners, and some of those companies will sell. New ownership comes in. Trio is one of those, and there's no good, bad, or indifferent on that. I'm just saying Trio they just changed ownership and changed names. So that's an example of that. It's common in the industry for these places to be bought out or sold. And so, what you may have heard from a neighbor about a place, I'm just going to be real clear because I don't want to badmouth anybody. What you may have heard from a neighbor who had their aunt in such and so place 5 years ago may be completely different now, good or bad. Okay? And so that's one of the things I will do. I have a client who's just moved in last week to independent living. And the first place we met and we went together I knew there were management issues. And so we sat down and talked about it. And I said, I just feel like you need to know this. If this is your choice, that's your choice. I respect that. I don't have any skin in this game. I just think you should know that if there's management issues, the staff will put on a good face to you, but they'll probably change a lot. And that may mean your level of service may go up, down, sideways. And so it's just a consideration. So, you may want to go back and tour again. You may want to take a look at that. Maybe this is just your place. Maybe you have friends there and you're fine with that. So sometimes I hear those kinds of things and I just try to be a little transparent about it. Mm-hmm.
There's also, I think it's on the government website, Wake County, it's called discrepancies, where you can look up discrepancies are considered complaints. And because they are required to go in and unannounced go into these places.
I think that's only licensed.
Yeah.
Yes,
Well,
so keep in mind independent is not licensed with the state, so there's not a level of being overseen.
And a lot of them will sell, like if they have a lot of discrepancies or problems, if it's a big company, they sell it to one of their subsidiaries, and all the discrepancies and complaints about them go away because they're under a new name, but they're still owned by the same company. So you have to do a lot of research, and you want to go in unannounced. Don't make an appointment, show up.
Or go in early if you have made an appointment and you want to tour.
Yeah.
I always think it's good to go early. I also will just caution you, I do think that people are much more likely to complain than they are to sing the praises of, right? And so, take that with a grain of salt. If you do see complaints, make note of that and then do your own research so that you feel like you've covered if it's a place that really makes sense from a location standpoint, from a price standpoint, you like the looks of it when you go. Sometimes what you can do is walk out in the parking lot, see if there's family or friends coming, talk to them, see what their take is on it. Try to get some of those unsolicited reviews and have people tell you what they really think. If there's any service providers that are going in and out, ask them. Yeah, Carol.
After 2 different surgeries, I needed a care that Richard would not have been able to give me. So in the hospital bed, I'm looking online because the social worker at the hospital wasn't good. All right, so I'm looking for a place and talking about discrepancies. So I'm looking to see what the ratings are, and I thought Medicare is going to pay whether I'm going to a 5-star that's at a little distance or a 1-star that's close by. So I'm going to go to the 5-star. Well, it was all well and good, and yes, on the whole, you have to look at the big picture. But I'll tell you, it depended on who walked the threshold into my room. I had good nurses and bad nurses, good CNAs, bad CNAs. You've got to look at the whole picture and say, this is life. Man, I sucked up to every one of them. I didn't care how sick I was. I did that because I thought, I'm at your mercy.
Yeah.
So I would try to say, your hair looks nice or something, just to engage them to see me as a person. It's a crapshoot a lot of times.
Yeah.
You could do your homework, even into some of these assisted living or, senior living.
Independent living.
And abound here. Good and bad meals, good and bad cleaners, good and bad everything's. And some of it is just like, this is life, there's no perfect place.
Well, and the truth of the matter is you really do draw more flies with honey than vinegar.
Absolutely.
Yeah, I will say, having spent lots and lots of time with my dad, who waited on a heart transplant and in and out of the hospital back many, many years ago, I just learned as a young person that you advocate for yourself and your family advocates for you. And Dad actually was in ICU waiting on a transplant at the end of his 26 months of waiting for the last 3 months. And this was 5 hours away from us, so we would come on the weekends. And he had a whole shelf of his own in the refrigerator in the nurses' lounge because they loved him so much. And in fact, we tried to get into the university housing. They had a little house you could get for a nominal fee to stay. The problem is, once you were in, you stayed as long as you wanted, so you never could get in just for the weekend. So we stayed at a hotel, but it's expensive, back and forth, and missed time at work, and all of that. And one of the nurses dated a guy who was in a wheelchair, and her house was not accessible. So on the weekends, she stayed with her boyfriend, later husband, and she never met us, but liked my dad so much. We stayed in her house on the weekends when we came. And we had a big garden that my dad had forced labor made his kids plant that year. So we would truck up, fresh everything, 'cause it was an acre, this garden was an acre. And so we had tomatoes and all the things, this was Missouri, and brought bags and bags of this. And we would leave this for the nurse and for the nurses at the hospital. And I will say, his level of care couldn't have been better.
Right.
But we greased that wheel. So I do think, flies honey. And so I always try to keep that in mind, that I'm not demanding if someone's in the hospital. I ask nicely, but I make sure that they know, we're here, we're looking, and if we have a need, we're gonna ask for it, and we expect you to fill it. So, if you have family who can go and you're in any kind of medical facility, whatever it may be, that's always good if you have an advocate in your corner. And there was one point, I remember a nurse my dad loved came in. This was pre-transplant. She gave him his medicine, and he knew exactly what he took, and it was double. She was working a 16-hour shift. They'd asked her to work double that day, and she was exhausted. And Dad caught it, and it could have killed him. So, as much as you can, you try to watch out for yourself, right? Or have family that can for you. So, and I know that's not always possible, but even if your family is there, like we were, once a week for a couple of days, they knew we were coming back, and they knew that we were, we would be checking up essentially. So even if you've got family that can't be there all the time, even if they just check in regularly, they know, the staff learns and knows who's cared for and who's not. Yeah. Okay, any other thoughts, questions? Yeah, Sandy?
Going back to hiring people, you call me agencies or come in your house. What I did with my mother, when we moved out of Sunrise, we went to a lodge. Of course, we weren't ready then, so we were traveling over to Durham for almost 2 years. So what I did is I went to Resources for Seniors, and I got a list of independent people, and they are so much less expensive. You ask for, what is it? You ask for who they work for.
References.
Yeah, sorry, I had brain trauma from an accident. And I got them for like half, and they would come in the morning, come in the evening, and they would bathe her and give her her pills and stuff. And it was great. I mean, I was paying them, this was back in 2009, 10, something like that. And I was paying them $15 to $20 an hour.
Yeah.
And they didn't have
One word of caution is they're not licensed and bonded. They don't have an overseer. So So it's hard, there's only so much recourse. So you want to be really careful if you're doing that because, if you're coming into a home where you have family heirlooms, jewelry, whatever, you have no recourse if it's an individual. So
Yes, they did
just a word of caution if you do that. I know a lot of people do. And I think there's some wonderful people out there who provide individual services, but there's always some who don't, yeah. Resources for Seniors, which is now, by the way, I know they used to publish a magazine, it's no longer published, it's only online. But they still have all of the same information available, and it is a great place to go for all things senior.
And what's the website?
I think it's resourcesforseniors.com. It's been a while since I've been on it, but yeah, I still have the last published magazine sitting on my desk. Yeah, but from A to Z. Yeah.
You can call them as well.
Yeah. Okay, any other questions or comments? A lot of good stuff here today. I look forward to seeing y'all in October. Thanks so much again for another great seminar. Tell your friends, let them know. We're here, we'd love to help you.